Okay, so now we're going to talk more about anatomical features of specific bones and how bones really work when it comes to leverage, for example, and different kind of lever systems. So we'll talk about the components of the systems, both axial and appendicular. What is the difference in axial and appendicular? Axial is
down the middle.
everything down the middle.
Appendicular is arms.
Right, and appendicular is going to be everything else, which has to do with arms and legs, including the girdle, right? Pectoral girdle and pelvic girdle. Okay. And we'll go through some very specific parts of bones. Remember, you're only responsible for the needs to know parts, unless my review exam guide tells you otherwise. If there's other that are not on the needs to know, it will tell you on my exam review sheet. Okay. So again, axial forms a longitudinal axis of the body. So this is the skull and associated bones. It includes the thoracic cage. It includes the vertebral column, and also any of the cartilages that are involved. So there's about 80 bones in the axial. This is about 40% of the bones in your human body. As opposed to your other body. And the components include, again, the skull and associated bones, thoracic cage, vertebral column, supplemental cartilages again. 80 bones. Shown in this picture. Notice the skull alone has 29. Be happy I don't make you know all of those. 25 in the thoracic cage, 26 in the vertebral column. And remember, we say we also include the cartilages as a part of the axial. So that's going to include the articular cartilages, which are at the ends of long bones of the joints. It also involves the costal cartilages that attach the ribs at the front and the sternum, and then the intervertebral discs between the vertebrae. So some of the functions of the axial skeleton: supports and protects your brain, also protects your spinal cord and the organs in the trunk body cavities. They are also attachment sites for muscles, like in adjusting the position of your head, neck, and trunk. Also, it helps with respiratory movement. Respiratory, so when you breathe in, you have this expansion, right? And when you breathe out, you have a contraction. But because you're able to expand the thoracic cage, that helps with the respiratory functions. You stabilize or position parts of your skeleton. You support the limbs with the axial skeleton. Any of the joints of the axial skeleton that do limit movement a little bit, but they're really strong. So that's a little bit different. So in your axial skeleton, your joints tend to be a little bit more limited. Now, a joint is just anywhere where two bones come together. Also, the technical term in the book usually used for a joint is an articulation. Articulation. The skull bones, there's 22 bones in total, 14 facial, 8 cranial. Then there's 7 associated bones, like the 6 auditory ossicles. These are little bitty bones in the inner ear. We actually have some in the laboratory, remind me to show you. They're actually found within the temporal bone. And when we study hearing in the nervous system, you'll get to know them a lot better. And then the hyoid bone, which is right here. It attaches some of the tendons to the muscles of the tongue and the larynx, cartilages. this lists all those, and we'll be going through some of them. Okay, your facial bones protect and support the entrances to the digestive and respiratory tract. Also here you have attachments for muscles, like those that control your facial expression, and those that assist the manipulation of food. By the way, you don't see all these types of facial supports and muscles in other animals. That's why you don't see expression in other animals. There's some embedded videos within some of these PowerPoints, so I'll show you these.
Some of the smaller facial bones include the nasal bones that make up the bridge of the nose, the zygomatic bones, which are known as the cheekbones, the inferior nasal concha, the maxillary bones, which form the upper jaw. They fuse together in midline, and people refer to this as the maxilla.
The cranial bones form the cranium and enclose the cranial cavity. And these are actually fluid-filled chambers. They help cushion and support the brain. You'll learn more about that when we talk about the nervous system. Then the inner surface has attachment points for the blood vessels, nerves, and membranes. So you'll be getting to know the internal skull a lot better. The outer surface, these are attachment points for muscles that move eyes, jaws, and head. And then the skull cap or calvaria is the roof of the skull, and it's formed by the occipital, parietal, and the frontal bones.
The cranium is the part of the skull that encloses the brain. It's made up of the frontal bone, which ends at the coronal suture. Behind the frontal bone are the two parietal bones that meet right on midline at the sagittal suture. Right below the parietal bones on each side is a temporal bone. The temporal bone and the parietal bone meet at the squamous suture. Taking a look at the back of the skull, there is one bone that makes up the back of the skull called the occipital bone. And there's the lambdoid suture. Spanning the floor of the cranium is the sphenoid bone. It's kind of shaped like a bat. And spanning the distance between the two orbits is the ethmoid bone. You can see part of it here.
Okay. Sutures are another name for the joints or articulations between the skull bones. And there's four major sutures. You have the coronal suture that attaches the frontal to parietal. Then you have a squamous suture that attaches the temporal with parietal. The sagittal suture that attaches the parietal bones to each other. And then the lambdoid suture that attaches the occipital to the parietal. Okay, within the face, you have paired bones. The paired facial bones include the nasal bones that support the superior portion of the bridge of the nose, connected to the cartilage supporting the distal portion of the nose. And you have lacrimal bones that form part of the medial wall of the orbit, the eye sockets, and then the palatine bones that form the posterior portion of the hard palate. These help contribute to the floor of each orbit. Again, I'm going to go over some smaller bone parts and even some markings which you don't necessarily have to memorize again unless it's on the needs to know or it's specifically stated in my exam guide. But I do want to mention these so you have some exposure. Okay, the zygomatic bones, these form part of the cheekbone. They also help in forming the rim and lateral wall of the orbits of the eye. And then the maxillae, by the way, that is plural, support the, well, that would actually be plural. Well, it includes other parts in addition to just maxillary, what we call maxillary bone. Okay, so it's more proper to say maxillae to encompass everything that's in that area. It supports the upper teeth, forms the inferior orbital rim, the upper jaw, the lateral margin of the external nares, most of the hard palate. The inferior nasal concha in the nose creates turbulence in the air, which is important for actually adding heat to it and also moisture. That helps with the gas exchange when the air actually gets down to the alveoli finally. And it helps with the epithelial surfacing warming and humidifying, as I mentioned. The single facial bone is the vomer. It's the inferior portion of the bony nasal septum. Then the mandible, of course, forms the lower jaw. So this picture shows all of those. By the way, one thing I like about this book and the slides is they're consistent with their colors. They always keep certain bones the same color throughout. Notice how many bones are found in there in the orbit. So I don't make you memorize all of those small bones. Okay, at the anterior view, we see the frontal bone of the skull here. Forms the anterior portion of the cranium and roof of the orbits. Frontal sinuses secrete mucus. And they're constantly flushing your nasal cavities. Then the sphenoid bone is part of the floor of the cranium. It unites the facial and cranial bones. It's also a cross brace that strengthens the sides of the skull. So hopefully as we're going along, you're also looking at those pictures in your book. And then the ethmoid bone forms the anteromedial floor of the cranium, the roof of the nasal cavity, part of the nasal septum, and the medial orbital wall. Okay, the parietal bones form part of the superior lateral surface of the cranium, so those are the ones at the top, the two that are paired. The occipital bone is at the very back, but also the inferior cranial surface where you find the foramen magnum. Then the external occipital crest extends from the external occipital protuberance. This is an attachment point for ligaments that stabilize the vertebrae. temporal bones, they form part of the lateral wall of the cranium. They articulate with the mandible and the facial bones, and they surround the sense organs of the inner ear. You see right in the center of that is the external acoustic meatus, that opening that goes into the ear. Also, the temporal bone is attachment site for muscles that close the jaw. Then we have the mastoid process and the styloid process. The mastoid process is attachment for muscles that rotate or extend the head, and then the styloid process is attachment to ligament supports the hyoid bone and tendons. So those parts we were just talking about. So again, that's mastoid process, styloid process. Okay. I think I'm going to forego this slide. The external acoustic meatus, I did mention, of course, the temporal bone. It's a canal that goes into the inner ear. It ends up tympanic membrane, also known as what? Anybody know? The tympanic membrane inside the inner ear. People often talk about bursting this eardrum. The zygomatic process of the temporal bone articulates with the temporal process of the zygomatic bone. That's the zygomatic arch. So closer to the temporal bone, this part is called the zygomatic process of the temporal bone. As we move further into the cheekbone, though, that is the zygomatic bone. I'm not going to go into all of these details. Again, a lot of these markings they mention are important parts that attach to muscles. Again, this picture shows you the point at which the zygomatic bone attaches to the zygomatic process of the temporal bone. Okay. I'm going to skip some of these as well. Do recognize that whenever we talk about meatus, we're talking about a small opening or passageway. A canal is a little bit larger, and these do have purposes such as entryways for vessels or nerves, such as in the internal acoustic meatus or the hypoglossal canal. I'm not making you memorize those. Again, a foramen is a passageway, and a lot of the foramen or canals that you see are passageways for nerves or arteries or veins, such as in the foramen ovale, the carotid canal. Again, I'm not making you memorize any of those. This also mentions some other foramen. The jugular foramen is between the occipital and temporal bone, and as you might imagine, it has to do with the jugular vein. In this case, the internal jugular vein. The internal jugular vein is one that goes into the brain. External jugular outside. Foramen magnum is that large opening at the bottom, the occipital bone. This is the forms a vertebral canal, and of course that's a connection of the brain to the spinal cord. I'll just mention the occipital condyles. You do see these at the bottom of the skull. These articulate between the skull and the first cervical vertebrae. They actually sit right on top of it, and they kind of rock on top of it. Two small facets that those fit into. So those are shown there, the occipital condyles. Also notice where the different foramen are found, the lacerum and the ovale, in the carotid canal, in the stylomastoid foramen, and the jugular foramen for the internal jugular. Okay, I'm not going to go through all of these. Again, these are showing some different passageways for different nerves. We'll be talking more about nerves, of course, when we talk about nervous system, and then we will refer to these openings more at that time. And these as well. Okay. I'm also going to kind of go through some of this part quickly. If we look at the sphenoid bone, this is the one that you'll see if you take the top of the skull off. And I think in laboratory you were having to do a little bit of coloring on these pictures. The sphenoid bone is the one that does look like what the lady said in that video, like the hat, right? And there is what we call a lesser wing, which is here at the top area, and then these are called the greater wings. And I think people get confused when they're coloring that picture dealing with that. So make sure you understand those differences there. I will mention the sella turcica. This is a really important marking, saddle-shaped enclosure. This is where your pituitary gland actually sits at the bottom of your brain. Saddle. I'm not going to go over each of these. I will point out that there are sinuses in the sphenoid, sphenoidal sinuses. I will point out the pterygoid plates. These are attachment sites for muscles that move your mandible and the soft palate. So those are shown here. Okay, in the ethmoid bone, there's three parts. The cribriform plate, that's at the anterior medial cranial floor, the nasal cavity roof. Here you have the olfactory foramina that permits the passageway of olfactory nerves for being able to smell. And then you have an area called the crista galli. It's a bony ridge, projects superior to the cribriform plate. I'll show you a picture in a minute. And it is an attachment point for the falx cerebri, which is a membrane that stabilizes your brain. You don't have to memorize any of these. I will say you've got a paradigmoidal labyrinth with two sets of projections called the superior nasal concha and the middle nasal concha bones that go into the nose. Again, you don't have to memorize those. And then the perpendicular plate that forms part of the nasal septum that goes down the center. So the ethmoid bone is that really small bone right down the center here. Obviously, they've just really blown it up really large there for you to see it. Okay, the palatine bone forms the posterior portion of the hard palate, contributes to the floor of each orbit. You have an orbital process that forms part of the floor of the orbit. You also have a small sinus that opens into the sphenoidal sinus. And then a horizontal plate, a perpendicular plate. Again, you do not have to memorize these parts. There are areas we call complexes, which are collections of facial bones. These protect your sense organs. You have two orbital complexes. These form the orbits, and each has an eyeball. And then you have a nasal complex that surrounds the nasal concha. So I'm not going to go over each of these parts of the orbital complex. There are several parts. Now, one of the questions in the lab had to do with the back of the orbit, that there was some potential weakness there, right? And the reason why is because you have so many small bones that come together. They're really thin as well. And I guess it's one reason why and I mentioned this too, in The Walking Dead, they always stab everybody through the eyeball. So you have to get to the brain to kill the zombie. Very important to remember that. Okay, let's see. I won't go through all of these. Okay, also the paranasal sinuses. So one of the reasons for having sinuses at all, it helps lighten the skull weight, but they also have something to do with the movement of air, equilibrium with pressures. In this case, the paranasal sinuses allow the voice to resonate. They provide a lot of air from mucus epithelium, which is important. Again, that provides some humidity to the air. It also can help in forming mucus. It captures foreign particles. And you find the paranasal sinuses in sphenoid, ethmoid, frontal bone, palatine bone, maxillae. However, unfortunately, a lot of times we have trouble with our sinuses, right? And when they become inflamed, you get sinusitis. Okay, the complexes also include bones that enclose the nasal cavities and paranasal sinuses. And these are air-filled chambers again. The sphenoidal sinuses and the ethmoid air cells, they do a lot of the same things. Now, some of the problems you have sometimes in dealing with sinus infections is hard to get something into it like an antibiotic. So that's one reason why sometimes you have to take antibiotics for a long time or a series of antibiotics to finally get it to work. In some extreme cases, they may actually have to penetrate the sinuses in a clinical situation. Also, some of you that have more extreme allergic types of problems or even vasomotoritis may have had to have some of these membranes removed at some point. You ever had a submucosal resection? I did. But I still have problems. But you've got frontal sinuses, palatine sinuses, and maxillary sinuses. Oddly enough, by the way, sometimes you don't even develop some of the sinuses like frontal sinuses. So everyone is different in the size of their sinuses and the number of their sinuses. To the mandible. Forms the entire lower jaw. It articulates with the mandibular fossa of the temporal bone. So, oops. So where it actually fits and articulates with temporal bone in here, that's the mandibular fossa. And it's subdivided into a horizontal body and what we call ascended rami, which I'll show you. Okay, and the part on the mandible that fits into the mandibular fossa is called the condylar process. That's that. Okay, so the condylar process fits into the mandibular fossa of the temporal bone. Anyway, when we talk about the ramus begins at the mandibular angle. It's an attachment site for the masseter muscle. And then we have the condylar process, as I've mentioned. It articulates with the temporal bone at the temporomandibular joint. This is where people have a lot of trouble. And then the mandibular notch. That's a depression that separates the condylar and coronoid processes. And then you have the coronoid process at the front. This is the insertion point for the temporalis muscle. Okay, the body, this is the horizontal portion of the mandible. So you have this area here. This contains the alveolar process that supports the lower teeth. Okay, some of the other features that you'll see, which I don't require you to memorize, but there is a line here called the mylohyoid line. This is where the mylohyoid muscle connects. Then you have the mandibular foramen. This model I've got in the class doesn't have it, but it's here. It's a passageway for blood vessels and nerves that supply the lower teeth. And then you have a depression marking. That is where the submandibular salivary gland will be found. That depression. Okay, other associated bones. A hyoid bone. That supports the larynx. And the larynx is below it, okay? Because the larynx is where you see or actually right below the larynx, the Adam's apple area. Don't get confused with where the hyoid is, because you can't feel the hyoid. The hyoid is up behind your jaw, okay? It actually is behind the jaw, okay, where your larynx is lower. Don't confuse those parts. I'm not going to go into the horns. You need to know those. Okay, as we go into the inner ear, you've got auditory ossicles. They are very small. They're important though for hearing because it's the vibration that they pick up from the tympanic membrane that transfers the message into the ear. The malleus, incus, and stapes. The fontanelles, they allow for cranial growth to keep pace with the brain growth in later fetal stages. So we talk about fontanelles in the fetus. I don't make you memorize the fontanelles. Okay? But the reason why you have them is for ease through the passageway during birth. Eventually they will be replaced with the sutures. So all of them are replaced before age 5. That's when the brain stops growing. The soft spot. I'm going to stop right there.